Minister Greg Hunt says the only reason you would hold off reopening is you don't have confidence in your contact tracing. Is that true?
No, that's wrong. Completely wrong. As I've just said to you about 50 times, there are 1,000 swabs plus in the laboratory, and we don't have the results for those yet. And once we do get those results, we'll be in a better position. We'll have a clearer picture to be able to make announcements.
New South Wales has been open for months with daily average cases of more than 10. They've dealt with outbreak after outbreak. If our contact tracing system is as good as theirs, if we have as much faith in the Victorian community as the New South Wales government has in their community, why can't we reopen?
Well, I don't accept the conclusions you're drawing at all. There's no question about faith in community. There's no question about the work that hundreds of public health professionals are doing right now, and community leaders and people in schools. They're all working very, very hard. This is a pause, nothing more than that. And it is appropriate that we wait to get these results. The reason that we have literally hundreds of people locked in their homes at the moment is because of the work that contact tracers are doing. So I just don't accept that criticism at all.
Premier, you talked about about the science and the numbers not being a roller coaster, but surely there has to be acknowledgement that the message to the public, or at least the way the public is feeling, has been a roller coaster. You've mentioned a lot that you understand that people are frustrated. Do you not think that it's gone past frustration today? I mean, I think today is a different level for the community in terms of what they thought was going to happen and what is happening.
And what we're doing is what's possible. We're doing what is safe. And it is frustrating that we've had this outbreak. It is frustrating that we've got a whole lot of results that are in the lab and haven't come back to us yet, but they'll be back to us soon. And as soon as we get those results, and hopefully they confirm that these are all cases that are linked and that there's not some much bigger problem out there that we don't know about, then we'll be able to announce steps and we'll be able to take them. That's all today is. And if that, of course people are frustrated, of course they are. Everyone would like these rules to come off as quickly as possible, but we only get one chance to do this properly, and we intend to wait for those results to come back from the laboratory. Once they have, we'll be able to make further judgments, and then we'll be able to update people tomorrow and hopefully make some announcements, if not tomorrow, then Tuesday, and then push on from there. And have the frustration. Sorry?
You don't think today will go beyond frustration? You don't think
well,
that the mood will change from where it was last time, that things were delayed?
Well, I would ask Victorians just to pause for a moment and ask a very simple question. Would it be safe to have thousands of test results in the laboratory that have not been processed and come back to us yet, and to ignore that fact and to then take steps to open up? I don't think that's the right thing to do. For the sake of a day, for the sake of 36 hours, this is the most appropriate thing to do. So we've got the most complete picture, and we give ourselves every chance of being able to contain this, not for days or weeks, but for months and potentially years. That's what's at stake here. Victorians have given too much, done too much, sacrificed too much for us to ignore the fact that there are thousands of swabs at the lab and they haven't been processed yet. They will be, and then we'll look at those results, and hopefully we can make those announcements very, very soon thereafter.
So is the strategy then dealing with future outbreaks? Are we going to be expecting to be locked down every time we have 70 cases?
No, but we have rules in place at the moment, and we have an opportunity to essentially get ahead of this virus. If you opened up now and those laboratory results came back and said, actually there's 30 more cases and they're not linked, it's in the community, it's everywhere in the northern suburbs, and the place is open, well then it won't be 30 for long, it'll be much, much higher. So holding the line for maybe not even any longer than what we were going to anyway in terms of the announcements we were to make, which wouldn't have come into effect until midnight Tuesday, just as the regional Victorian ones I've announced are. Holding that line, waiting for those results, means that we can be much more certain about where things are at as we open, and we can make much more accurate judgments about the risks that we're going to have to live with.
I understand that, but are we just lucky that we're in this lockdown at the moment? Like, what if we were open right now? Would you have to lock down Melbourne?
No, I don't think that's right at all. I think what we will have to do for a very long period of time is manage and live with this. But it will be easier, it will be much easier the lower the numbers are at the point you open up. And as well, the more you know about those cases and the more confident you are that you've got a public health response around all of those people. As it stands now, we don't have that complete picture because the labs are processing tests. There'll be other tests taken throughout the course of today, which will come to us tomorrow. This is nothing more than simply waiting to get the results before you, or put it another way, waiting to get the results instead of pretending we know what those results are. We just don't, and that would not be a responsible or a safe thing to do. And if we're criticised for that, well, so be it. We're going to get these results today and tomorrow, and then we'll make further announcements, and we'll have a more complete picture than if we were to simply pretend that we know better. That just isn't the right way to go. Those people have got tested for a reason, and it's not too much to ask that we wait and see what the results of those tests are throughout the course of today and into Monday.